Well, President Cyril Ramaphosa is scheduled to sign the contentious NHI Bill into law in the next hour. Government is touting it as a way to transform South Africa's healthcare system and to ensure universal coverage for all. Let's take you live to the Union buildings now and to our reporter Juniour Khumalo, who's tracking this story for us. So 57 minutes thereabouts, Juniour, is when the President will have found his pen and signed that bill.
Indeed, Michelle, in less than an hour, the President will be signing that contentious bill. He has been looking for that pen for quite a few months now. It's been over 3 months since the National Assembly actually approved this bill. So it's been sitting in front of the President's desk. But today we're going to get some finality. I'll just step a bit out of camera just to let my colleague Morena just show you where the President is going to be delivering that keynote address before he signs the bill. And then to our right, that's where the President is actually going to sign that bill this afternoon. So it's been long in the making. It's something that has been in the making since the crafting of the Constitution. As you know, from Section 27 of the Constitution, it is inscribed that healthcare, access to healthcare is a fundamental human right, and South Africans are all entitled to quality healthcare. So in crafting this bill, the ANC government was attempting to basically make sure that all South Africans really do get the same and equal health care. But there's a lot of criticism when it comes to who is going to fund the NHI and what is going to happen to medical insurances. So those are some of the complaints that have been raised by civil society as well as opposition parties as well. We do know that the DA will be outside the Union buildings today, and the DA leader, John Steenhuisen, is expected to speak to the media about some of the complaints or that they have about this bill. They cannot challenge the entire bill. They're going to challenge certain sections of the bill should they go to court. So it will be interesting just to speak to him as well and just to find out, Michelle, what exactly they'll be challenging about that bill.
Yeah, absolutely. I mean, it's a noble desire, right? Of course, it's something that all of us want: equitable access to quality healthcare interventions for everyone in the country, no matter your income, whether you are from a low or middle or high income household. It's a great idea. But what are some of the critics of the bill saying about how prepared we are? Let's perhaps start with the issue of governance for one. How prepared we are insofar as governance in the healthcare sector to implement a bill of this nature and a bill of this magnitude.
I think that's one of the biggest questions that a lot of civil society as well as political parties have been asking in terms of who is going to fund it. That has supposed to be ventilated by government in terms of what sort of taxes are going to be introduced. And already South Africa has some of the highest taxes in the world. So employed South Africans are actually some of the people that are going to be complaining in terms of how much this is going to cost. Some of these studies have since suggested that it's going to be about a 33% increase in the taxes that South Africans pay when this NHI is introduced. But also it's still not clear how then, which type of increases are going to be added to those taxes as well. But also, as you spoke about the facilities, when it comes to the public facilities themselves, are they ready to then take up this NHI? Are they ready to then take up the people that are going to be going to these public facilities? Do they have enough healthcare workers as well? Are some of the questions that have been asked. As well as the public sector itself has been asking questions. What happens to the public sector hospitals that are not willing to be absorbed by the NHI then? As well as medical aids, as I already spoke about. What happens to individuals who've been paying medical aid for years now? What is going to happen to the money that they've been paying? So those are some of the questions that we expect actually the Health Minister, Joe Phaahla, to actually answer after the signing of this ceremony. So the President, this is how the program is going to be set out at the West Court of the Union building. The President is going to deliver a keynote address. He is going to sign that bill into law as an act, and then we're going to get a Q&A with the Health Minister, who's going to try and ventilate some of these questions that we've been asking, Michelle.
Yeah. You know, the issue around whether we have enough healthcare professionals in the sector is also a big one. I've got the little printout from the Department of Health on NHI here in front of me. And part of what it talks about is bringing back even retired doctors and nurses to try and play a role in the healthcare sector, perhaps with training and that kind of thing. That's ironic, isn't it, Junior? Because we've been tracking stories for weeks now of healthcare professionals who are unable to find jobs, who have been camping outside the health department, demanding placements.
Indeed, Michelle, from the beginning of the year, there have been a lot of qualified doctors, qualified nurses who've come, some of them from Cuba, from Russia, who have completed their degrees, but they seem to not be able to find the jobs that they are seeking. They've been camping outside the health minister's offices. Some of them have also come to the union buildings just to air their concerns, but they haven't been getting jobs. So where is then government going to get the money to now absorb them and pay them? Because one of the concerns has been that there's no budget to the Department of Health. So that was another concern. So we expect the health minister actually to address some of those issues. I'm guessing some of the money is going to come from that increase of taxes. But I think with the NHI bill is to just what is important to take note of is that it's not going to be rolled out immediately. It's something that's going to actually take a few years to actually come to being. Some have suggested that it might take about 5 to 10 years to actually be fully rolled out, because there has to be public sector health care centers that have to be absorbed into the system first. So they need to basically say yes, agree to be part of the NHI. There has to be public sector workers as well, public healthcare workers, who also have to be absorbed into the NHI. So there's a lot to be rolled out first before we can see it fully functioning, Michelle.
And of course, there's the question of timing, right? We are, I want to say weeks away, but that's not right. We're about a week and a half away from what's being touted as the most important election in our history since 1994. You say the president has had the bill on his desk for more than 3 months. Why sign it now?
Indeed, we are about 13 days away from the elections, so the timing has also been questioned by a lot of opposition parties. We saw the DA leader yesterday hold a press briefing where he did say that basically this is a form of electioneering by the ANC president, Cyril Ramaphosa, because he's been sitting on this bill for over 3 months. He has been sitting on it, though, because there has been some challenges from some organizations who've been threatening to go to court if he does sign it. So the presidency, actually, to be fair, has been engaging with those organizations and basically trying to explain to them why this is important. We know that about 89% of South Africans actually use public service healthcare, which at some point has been failing a lot of South Africans because of the shortages that we spoke of the healthcare workers, but also of the numbers of people that have to go to those public sector healthcare services. So the president has actually been trying to then educate a lot of South Africans around this. There's been a lot of public debates also that have been held around this bill itself. But still, even with those contributions from civil society and a lot of opposition parties, the president has since decided to sign this bill itself. But also it could be argued that parties such as the DA themselves that are arguing that he should not sign it, they are also using it as an electioneering tactic. As I already indicated, the DA leader, John Steenhuisen, is going to be outside the union buildings today as well. So that also can be seen as some form of electioneering ahead of these elections, which are 13 days away, Michelle.
No, absolutely. The opportunities for politicking are many, aren't they? Juniour Khumalo, let me thank you for your time. He's live to us at the Union Buildings. It's now about 45 minutes to go until President Cyril Ramaphosa is scheduled to give that keynote address and then sign the NHI bill into law.